I'm Marion. I'm part of the Bandon Community First Responders. We've been asked to come here to the Bandon Co-op today to speak on emergencies that can occur on a farm for Farm Safety Week. We respond to cardiac arrest, chest pain, strokes and choking. We work with the National Ambulance Service, and when somebody dials 999 or 112 asking for assistance with any of these cases, then we respond and act as kind of the bridge until the paramedics arrive on the scene.
Okay, chest pain. It's very common for chest pain. Okay, there's good signs and symptoms of a heart attack is chest pain. Basically, what happens is part of the heart muscle there is blocked. Okay, once you get chest pain there, it can be a radiating pain through the side of the body, or down the shoulders, down the arms. Okay, you might be feeling unwell. Your skin might be cold and clammy. There are signs and symptoms there. If there are, straight away, the first thing you should do is just sit down and relax, okay? And try not to do too any work, because what you're doing then, you're putting more pressure on the heart, okay? Now, a heart attack can be serious, but most of the time it's not, okay? So what you do is you sit down, relax. Once you've relaxed there, okay, if you phone 999 and 112, they'll advise you to take an aspirin, right? A 300 milligram aspirin, okay? What we do is the first responders might turn up, they might give you an aspirin, but they do advise you, on ambulance service, do advise you to give aspirin. What that does is an anticoagulant, okay? So it stops any more buildup of what we call the white blood cells and prevents the blocking. So aspirin, as you know, is a drug, okay? Even though you can buy it over the counter, but you must recognize that if you're allergic to aspirin, you can't take them, okay? If you're on any blood thinners, okay, you can't take an aspirin. So if you've got active ulcer, okay, in the stomach, you don't take aspirin, okay? And if you're a child as well, under 16. Aspirin is basically just one little Disprin, okay? Pop it under the tongue, if you can, okay? You can also put it in a small glass of water as well.
Okay, so lastly, we're going to just discuss how we would manage somebody that we suspect of having a stroke. So we would obviously ring our 999 or 112. To get an ambulance, but there is a test that we can do to inform the ambulance crew as to whether a person is FAST positive or not. So what we mean by FAST positive is firstly face. So we would ask the person to smile, and we're looking for symmetry in the smile so that there's no droop on either side of the mouth. We would ask them to raise their arms, and we're looking that there's no downward drift in either arm. Okay, speech is the next one. So we would ask them to repeat a sentence. So a simple sentence just to see if there is any irregularities in their speech. So either that they're slurring or that their words are muddled up. And time, so we would tell the ambulance crew how long that these symptoms have been going on. I suppose if we're with the person, we're supporting the person while we're waiting for the ambulance crew. We're not giving them anything to eat or drink in case their swallow has been affected. And we would be gathering like a bag for hospital and their list of medications. And I'd just like to say I hope you found these videos helpful and that they benefit you in your everyday work, and that hopefully prevention is better than cure, and that we're always looking for volunteers and Bandon First Responders. So please contact us if you would like to volunteer.